My name's Karen Hickson, and my wife Liz had a brain tumor, and she passed away almost 2 years ago now. I have a really good job. I had really good insurance. These are all things I thought we were pretty okay. There was hardly space in my brain for anything else other than like getting Liz to where she needed to be. All the meds had different times. I had a schedule of all of her medications. We had to go to Denver, so I had to arrange like where we'd be sleeping and how we were getting there and like all these things. And I could barely get her from her chair to the car some days without it taking forever. And it was just this one more thing. It was just one more, like, oh, I have to remember to make 4 calls because I have to talk to the billing person at the office of the medical doctor, and then I have to talk to the insurance, and then I have to talk to the appeal number of the insurance because it can't be the same phone number. That'd be too easy. And, I have to make sure the bank account can cover this next swing of funds that will maybe get refunded. And even the one hospital that says they condensed their bill, it was ridiculous. I mean, a condensed bill, like for one MRI, could be 4 pages. And I still didn't understand what was going on. It's not that hard to write in a way that people can understand. All these things you pay for have the same name on the bill, but they have a different number, and you have to keep track of all the numbers so that you paid the right people. Because in most of those things, all the x-rays and labs and stuff are stuff you pay for, and then the insurance has to refund you. So if you don't have the pile of money, there's no way you can get the service to get refunded for it unless you wait. And with stuff like brain tumors, you can't wait. You have to jump on treatment. If it was simple, if it was, here's my insurance card, or whatever, if it was one thing, I could maybe deal with that, but it became all of these things where you get bills from 3 different companies for one MRI. And then of course all of them either have some sort of friggin' portal, and none of the portals are connected. So you log into your My Health portal with Dr. So-and-so, and then you have another My Health portal with Centura Health, and another My Health portal with this other hospital. Every time we got an MRI, I would have to go down, it was in the hospital, I'd follow the red line to the gray line. This is all I remember. And I'd go to the gray line, go to the last door, and I'd enter this room where there were all these SpongeBob SquarePants figurines, don't know why, and get this lady to burn a disc with the MRI results, because I knew when I'd go to the next specialist doctor that was treating Liz, they wouldn't be able to access it on the open portal and they never could. And so I'd be like, here's my disc. Just another complication, because I'd either have to drag Liz with me, in the wheelchair in the hospital, or leave her parked somewhere. When Liz was really sick, she was doing these experimental treatments that required a certain timeline. And I knew that she'd get kicked off of the treatment if you didn't follow the timeline. If you don't get your MRI within X amount of hours of getting this injection, then and I wanted the best possible treatment for her. And if you don't make that timeline, you're screwed. And so you have to get the right stuff to the right people at the right time. And it could all have been online. It doesn't need to be that complicated. It doesn't need to be that expensive.
Here's another example of why we need universal health care. In our America, the decisions are made by those who show up. Will you show up? Please click on the like icon below. If you want to know when we release new videos, click on the subscribe button.